Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. We got an awesome show for you today. First off, Brotox. Men's Botox is surging. We're going to talk about it and why that might be happening. After that, is COVID striking back? There are more cases. We're going to talk about it. And then finally, Kelly Osbourne is denying plastic surgery rumors. That's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for joining us. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to hear from you. I'm Dr. Hermann, your host for Nip Talk, and with me, as always, is the amazing Sarah.
Hi.
Doing good today?
Yeah.
Good. In the box, we got Travis, man. What is up?
Hey, what's going on?
Travis, someone just told me the other day how much they like you. They were saying, I like Travis, so I wish he talked more. And I'm like, well, sometimes I think he gets wrapped up in the producing and maybe,
Yeah.
doesn't always have time to jump in. But no, really, for real. Somebody last week was talking about the show, and they're like, yeah, we really like Travis.
That's funny. I'll try to chime in a little bit more. How about that?
You can anytime, man. I mean, I'm
got
not
you.
getting on to you, but
I got you.
everybody having a good week into summer? Anything good
Yeah,
planned?
It's still pretty hot.
It is. Oh my gosh, I think today was supposed to be 107, right? Or something crazy like that.
Yeah,
108?
for a minute there it was like in the 90s.
I know. I thought summer was over, and I think this is kind of the last summer. In fact, we were thinking about doing the pool this weekend because after next week it's going to get down into like the 60s and 70s.
Right.
Yeah, it's supposed to get cold. Well, I call that cold, which, I mean,
I think it's supposed to rain too next week.
rain.
It was raining on the
What
way
is that?
when I was driving here. Like
Man,
little sprinkles.
my wife and I were just talking about, like, everything in our yard is dead. Like, we couldn't
Yeah.
keep anything alive this year. I mean, it was
My
just,
grass is so dead.
Yeah.
I
gave up.
I haven't mowed it.
I haven't mowed in forever. There's no reason to mow dirt. I mean, I for a while we were trying to, keep the yard going, but then it just was, a losing proposition. It was just too
It's a
hot
waste
this
of
year.
money.
Yeah.
for the
and there was
water
no rain,
anyways.
If there had been rain and it had been hot, it'd have been one thing, but man, it was a dry, hot summer.
Yeah, some of my bushes are just dead.
We even lost, I think, some trees, which kind of sucked because trees are expensive, We had some trees that were a few years old, and you get busy and you don't think about I have to water my tree, and
yeah, because did you plant it?
yeah, well, not me personally.
Oh.
I kind of watched while someone planted it.
Oh, well, yeah, but you had it. You had
I mean,
it
I
planted.
can do work. I'm
You
not
had it planted.
Yeah, I'm not that. I don't know if I'm trustworthy enough to properly plant a tree. I mean, I might mess it up.
Oh, my dad used to plant trees all the time.
Did they live?
Yeah, there are huge trees in my
Should have got your advice.
my
then,
family's
because-
house.
Yeah, we lost a couple of trees. Anyway, I hate to lose trees because one, they're expensive, and two, you put we had a few years into these trees.
Yeah, I have a lot of dead trees in my yard, but I didn't plant them. They're wild.
Oh, they're wild trees.
Yeah,
Yeah.
but they just died.
I know. It's really sad. It's been this summer. I'm kind of over the summer.
Yeah, but then as soon as it gets cold, we'll be like.
I know, right? I know. I always say I'm over the summer until the first time it hits 40, and I'm like, oh my god, when's summer coming?
I know.
But we are going to do the pool this weekend. It's the last. Well, I don't know. It depends on how willing you are to tolerate cold water. But once the weather starts dropping, man, the pool's going to get cold.
Yep.
So
It
this is kind of the
definitely will.
last one before probably the pool.
I got a paddle board for my birthday, when you blow
Did you?
up. Yeah, and I haven't gotten to use it yet because every weekend I've been super busy, and I don't want to take Avery on it yet because I haven't even gotten to do it
Where are you going to go?
myself.
Ray Roberts?
Yeah, that or Lake Louisville. That's the
Oh, don't
closest
go to Lake
one.
Louisville, man. That's
I know it's a gross lake, but
it's
the
gross and
closest one.
dangerous.
It
I
is?
grew up on there, so I feel like I can talk crap about it.
Dangerous. Why? Just from
so many
boating
boats, yeah,
accident?
boating.
Oh, well,
People
I'm
get
not going to
drunk.
go out in the wild, in the middle of the lake.
No, definitely don't do that. You stay
No.
close to shore.
Yeah.
My wife did paddleboarding. She said she really liked it. I've never done it.
Yeah.
Have you done it before?
That's why I wanted one. But yeah, I haven't gotten to use it. I think I'm just going to do it this weekend or something.
Yeah, try it. I'm sure you'll do fine. You seem like you have pretty good balance and whatnot.
I hope so.
Yeah. Just don't get out in the middle of the lake.
No. I do it over there, by the little lake beach that Little Elm has.
Oh, right.
They're
Yeah, I know what
used
you're
to a
talking about.
bunch of
Yeah, it's pretty safe.
pedestrians around.
Yeah,
on
no,
the
I know
water.
exactly what you're talking about. In fact, we have friends that live over there, and we would go out on their boat sometimes, and we'd always launch from over there.
Yeah.
Yeah, it's fun. Good times. Do you do lake stuff, Travis, or?
No, I cannot swim.
You can't swim?
No,
my
I cannot.
gosh,
I
really?
am almost definitely afraid of water.
Really? Okay.
Yeah, big bodies of water at least.
Yeah.
Yeah, it's not for me.
I hear you.
It's
Yeah.
not for me.
I
So-
kind of grew up doing the lake stuff, so I always liked the lake. But and then my wife grew up on the beach, you know. Well, not like on the beach, but in a beach town, and so she always used to go to the beach, and so she kind of like looks down on me because I used to like go to the lake. She's like, yeah, the lake.
I
gross.
feel like I just don't understand how you don't know how to swim.
Well, thanks, Sarah. So
There are people out there. I mean, if you don't grow
Because
up
that's
around
like that's like a survival skill. I feel like.
all right, well,
dude, oh man, she's like questioning your manhood,
I know
Travis.
it, I
Like,
know it.
I don't know.
and,
how you
and
should
fairly
feel about
so.
this.
But I mean, I guess
Fairly
your
so.
family you just grew up not doing
Yeah, kind of sort of.
swimming
So,
adventures.
What actually happened when I was a kid, I went to Hurricane Harbor and I went down the slide. Didn't know it was water. This is a long story short. I didn't know it was water at the bottom of the slide, and then when I get to the bottom, I started drowning. And
Oh my gosh.
but it wasn't. It was like 3 feet of water. It
Oh,
was-
she just like stood up.
the lifeguard didn't even jump in. He was
They're
like,
like, dude,
"Stand
stand up, man. What are you doing? You're embarrassing yourself.
up." Yes,
That's got to be traumatized. I can see why you might avoid the water after
it was
that.
terrible. It was terrible. It was
I'm
terrible.
Sorry, man. That sucks.
I'm sorry.
That's a good story, but
It was terrible.
oh man, traumatized you. All right, well.
But I will learn one day.
Yeah, I mean, you might as well. I mean,
Yeah, facts.
yeah, but I can see how if you're not used to it, that it'd be
I was
very
definitely
intimidating.
scared of the water until I like did it. Like
Yeah.
till I finally was like, okay,
Yeah, I've always liked the water. Like growing up next to the lake, I was like, just drawn to it because
yeah,
don't have anything else to do. So.
yeah.
But, all right, let's move on to some topics for this week. So, actually, I'm gonna have to thank the people at Paired Up. So, Paired Up does social media marketing for me and for the show, and they actually pointed out that there was a lot of articles this past week about Brotox.
Okay.
You guys have heard that term, right? Brotox.
I've
No.
never.
No,
I've heard-
you haven't.
It's a good term.
Man,
though.
I always forget like what is common. So Brotox is basically men getting Botox, and
Yeah.
and I actually got a really funny story about this before I kind of dive into this. So Jackie Kostick, who's one of the girls who works for Paired Up, had sent me an article about Brotox, and so I was like, okay, well, I'm gonna start like looking. So I pulled that one up. So I pulled up this other article and was reading it, and it had my name in it. Like it had a quote from me.
I saw that on Instagram.
Yeah, I posted because it like blew my mind
Yeah.
because I was like, wait, I'm quoted in the article I'm reading. And it was so funny because I actually had done a interview with Huffington Post like a year ago about Botox. And I guess they just pulled the quotes from that article. But it was so long ago that I wasn't, expecting
Yeah.
to see my own name in an article I was reading. It was
That's
really weird.
fun.
Yeah, it was kind of cool and also a weird feeling. My daughter was sitting there, I was like, oh my God, look, my name's in there.
You
Like,
are published.
They know me.
I know.
You
Anyway, all right. So getting back to it. So in this day and age, there's about 7 million people a year who are getting Botox in the United States alone. And of those, right now, we estimate it's about 500,000 of those. So 1 out of 14 are men. And those numbers are growing. So I don't know. What do you think about that, Sarah? Like, all right, so you're out on a date and maybe you notice like that the guy, maybe they're not moving the way they should.
Like their face.
Yeah, like they're
Yeah.
well, you know how people look with Botox, or do you not? I guess do you have friends that get Botox? I know you don't do Botox, right?
No, I really want to.
Dude, come
but,
by, I'll hook you up.
Okay.
So what you get is like you get less facial movement,
Yeah.
and people have like a
I've seen it like on like TikTok. Like they're like 1 hour after Botox, and they like do all these like
right, yeah,
facial
that's all like
expressions and
nonsense, by
stuff,
the
and
way.
then like
Yeah.
a week later,
then it's like nothing.
then they.
So
can,
what'd you
like,
think if like
move
the
it.
guy you went on a date with said that they were getting Botox? I mean, I would probably wouldn't. I mean, nowadays, whatever.
I don't think I would think it was weird, especially like if I knew, like if you can obviously tell that they like take care of themselves.
Sure, like they're put together well.
Yeah, like and if they're like, yeah, I get Botox for like stuff that like you have to do it because you're insecure about something, or just don't want, or you're preventing.
Just preventing, yeah.
Wrinkles or something, because I know that's what I want to do. Is like I don't want the wrinkles on my forehead to get any bigger,
Right.
so I need to go.
Yeah, I mean,
Do it.
You're due.
Yeah.
I mean, I'm in the same boat. Travis, you got any buddies? Non-female friends who get Botox? I personally don't.
Travis probably does get Botox.
Travis, you get Botox?
I do not. I've never gotten Botox before. I'm trying to think. I don't know anyone that's gotten Botox in my immediate circle.
Okay. Yeah, I personally don't either, and I would say that in my practice we don't have a large number of men getting Botox. We have a few. We do have a few, but every year that percentage goes up. And to be fair, every year more women get Botox, but the percentage of men getting it versus women is slowly catching up. I mean, and when I say catching up, it's still way down. Like it's something 92% of Botox is by women.
Yeah.
But that small percentage of men each year gets a little bit.
Well, guys usually don't. I wonder if skincare for men has gone up too.
Of course, it has. Absolutely. Yeah, you're absolutely right that it has. And looking over longer time frames, like over the last 10 years, yeah, absolutely. Year to year, it gets just a little bit each time. And so I think that the articles recently that came out, a lot of it, I think, is due to this whole Barbie surge. We were, I think I was talking about on an interview, not as much on the show here, but there has been this kind of idea that more people are seeking out procedures because of the movie Barbie, and so they were talking about Ken. Have you seen the Barbie movie?
Yeah, 2 times.
Are you Ken enough? Right?
Yeah.
The same reason that women might see somebody on a movie where it'd be Barbie or else, and they're very well put together. Now they're saying, well, maybe men are seeing Ken and thinking, well, I need to change some things. I would say that probably bigger reasons are more related to things like the Zoom effect. The Zoom effect was whenever the pandemic hit and we were all on Zoom and people were seeing themselves. There were plenty of women and also some men that started to notice things about their face that they didn't like. The other 2 things that are big are studies on how people that look younger in the workforce are more likely to get hired or get promotions. That's a reason. And then also just flat out ageism. There was a big lawsuit with Google by men about ageism, that the older men were getting pushed out of positions.
Yeah.
So,
well, for the longest time, it's always been girls that are like, you can't get old, you can't look old.
Right.
And men are like, and they would embrace their age almost.
Yeah, one of the articles. Oh, yeah, fill up those articles there.
Growing old for a man is manly.
By the way, Charles. Yeah, so those are the 2. The one on the left is the one actually that. So she sent me the one on the right, which was a good article, and then I pulled up this one on the left, and then hit that next slide, which was kind of funny. Like I had my name in it. I was like, wow, that's so crazy.
That's dope.
It was cool, man. It was just kind of really weird. I mean, sometimes I know things are coming out that I submitted stuff for, and then you're expecting it, but when you're not expecting it, that's kind of interesting.
Yeah.
So just briefly, I think everyone knows what Botox is. I mean, it is a neurotoxin. It's from the botulism toxin that they harvest for medical use. The 3 places that it works really good for are the glabella, so these frown lines right here, forehead lines right here, and then smile lines. And the reason I haven't used it, well, one of the reasons is I just genetically don't have lines, although I'm starting to get one. Let's see, where is it? I think it's right here. Yeah, it's getting there. I may have to start doing the Botox. My nurse is always getting on to me. She's like, those wrinkles are starting to get a little bit more noticeable, and you may start doing it.
Oh my God.
I know, they're so mean to me. But I haven't done it yet. And the reason I hadn't really thought about it is just I am genetically blessed with I don't get wrinkles as quickly as a lot of people do. And so, I personally haven't dived down that road yet, although I have done the laser, and I really love the lasers, which, lasers do things by different mechanism. They use heat to flatten out skin and improve your skin quality, which is completely different than Botox. But the end result is the same, that you're trying to look younger. And I really do like the laser. I'm going to use that thing every year. But I haven't personally gone down the Botox road. But I just wanted to kind of talk to guys out there. If you're thinking about doing Botox, I do think it works great, and women that do it love it, and even the men that I've done Botox on do really like it. But there is one thing that you have to think about if you're a guy thinking about having Botox. You don't have to worry about this, and you don't have to worry about getting it here as far as any issues, but your forehead's the one area we have to worry about, because the way that a lot of injectors do Botox, it does tend to arch the eyebrows up, which I don't know if I can make myself do it. I can't really do it. Arch, I can't. Just imagine arched eyebrows. I can't do it on the spot. I have stage fright. But that arched eyebrow look that a lot of Botox results give is something that doesn't necessarily look good on men. Like a lot of
it's
women,
like more feminine.
yes, arched eyebrows are definitely a feminine type appearance, and so you have to be careful if you're a guy thinking about getting Botox that your injector knows what they're doing to prevent that from happening. And there are like technical ways that you can administer the Botox to keep the eyebrows from arching. In fact, we have plenty of girls in the office that don't like the eyebrow arch for whatever reason, even though it is primarily looked favorably on by women, and they want something that's less of an arch.
Yeah, because like personally, like, because I have RBF really bad.
What is that exactly?
Resting B-word face.
Sting bitch face.
I got
So
you.
like, if I'm just like resting, my face looks like
Like
it
you
looks
look
like
evil.
I'm like, yeah.
You're like,
Because I look like I have like a big, like, I don't know. I feel like I have to like open my eyes like this to like be happy. For like people to not,
I'm gonna tell you, Sarah, and I would
for
be honest
people
with
to
you.
not like look at me like,
I'm
are
gonna be
you
a-
okay?
I'm gonna be honest with you. I have never really thought that you have the RBF.
Oh, well, people think I do.
Really?
A lot of the
I
time.
don't see it, personally. I mean, I'll call people out if they have
Travis
it.
knows, even though he didn't know.
Travis.
I must say, when I first met Sarah, I was cautious to speak just because I was like, oh, she look mad. She look mad. Yeah, I was like, she look a little mad.
That's
Yeah.
funny.
But Sarah is the sweetest person.
I guess
nicest
maybe like the
person.
first time I met you was like in a very social kind of like
Yeah.
environment, and
There
so
was
I've always,
beer there.
huh?
There was beer there.
Yeah, there was beer there, and so I always remember Sarah like as, hey, we're all having a good time and happy, and like there was like music, and so I don't know, maybe it's that first impression.
I have to like meet people, be like, hello, hi.
I don't know. If you think you have, maybe it's time for the Botox.
No, I've heard it everywhere. It runs in my family.
You should try it out.
All of my sisters. If we're all sitting there, everybody's
Oh,
like,
I will say,
did
and-
something happen?
And I'm not like at all picking on you, but I mean, you are starting to have like passive lines. You
No,
know?
they're definitely there, and it gets worse with makeup.
Yeah.
Whenever I turned 30, I started noticing the one right here.
Yeah. Yeah, they do pop up right around 30, so it's about
I was
that
like,
time,
go
Sarah.
away.
I mean, not that you have to. You look
Yeah,
beautiful no matter what,
Bruce.
but if you wanted to do it,
No, I've already been. It's already been in my mind for a while.
Yeah.
And then you can, if you're a guy and you're weird about having Botox, you can always just say you have really bad migraines.
right? That is a great idea,
Because
Sarah. Yes.
that's what,
Yes.
because I used to get migraines really bad, and my doctor was like, I can prescribe you Botox if you want. And at the time, I was like in my 20s, and I was like, I'm not an old woman. Why do I need Botox?
I'm not old. I'm not 30.
Yeah, no, I'm like.
So, and that's
maybe.
another thing, and I'm glad you brought that up. A lot of and I mean a lot of our patients that get Botox who have chronic headaches, whether they be regular headaches or migraines, will tell me that when their Botox is working, they don't have as many headaches.
Yeah.
Yeah. So that's a great idea, guys. If you're, maybe your friends are mean, like Travis's friends, and they would make fun of you if you went and got Botox. So just tell them you have headaches, and then you're off the
Yeah,
hook,
I
and
have
you can
headaches.
look good and still not, lose that man card.
Facts.
Which I personally don't think you lose your man card if you want to use Botox. Personally, even though I haven't done it myself, I think it's totally fine.
No,
So,
I
but you
don't-
know
I
how
wouldn't
how
care.
it is. I have a couple guys that come in that you probably wouldn't think they would be classic Botox users. We have some like oil field type guys, and I don't know if exactly like oil field, but I'm talking out
Blue collar type.
yeah
girls.
blue collar worker dudes that come in to get some Botox. Yeah.
Nice.
Yeah. I mean, it still is mostly
I
women.
mean,
but-
like if guys are comparing themselves to celebrities like
Yeah.
women do. I mean,
because those celebrity dudes
Yeah,
to get
those
Botox.
guys are- those
a
guys
lot
are
of them.
getting
Yeah, lots of
Botox
them
and
are, or
fillers.
lasers or whatever. Yeah.
yeah.
So guys, don't be afraid to look young. There's nothing wrong with that.
Facts.
Facts. All right. Well, let me know if you are a guy that uses Botox. Let me know what your thoughts are on it. What is your experience? Or if you're a girl that wants to get their boyfriend or husband to use Botox, let us know. Maybe we can give them some good ideas of how that can happen.
Make it a
So,
date.
That's right. All right. Let's move on to another story that hit the news in the past couple weeks. And I don't know. Have you guys heard about COVID making a comeback?
Yeah.
Absolutely.
Yeah, I have too. All right. I want you guys to check out my graphic here. What do you think? Like,
Yes.
do you recognize it?
I approve.
Yeah.
Is it Star Wars?
Yeah, it's the Empire Strikes Back.
Empire Strikes
Star
Back?
Trek.
It's
I'm just
COVID
joking.
strike. No, it's
Star
it's
Wars.
Oh my gosh, Star Wars.
I'm just joking.
Anyway, so there has been a lot of news articles popping up lately about COVID kind of coming back, and I have to ask you guys, Like a month or two ago, did you guys even think about COVID at all? Like,
I stopped thinking about COVID as soon as the
years
bans
ago.
were lifted off.
Yeah.
I stopped
So I think a lot of people around here are in the same boat as you. But I mean, being medical, I have,
it changed.
keep
everything
able on
pretty
it, a
much.
little bit more because of just the regulations and stuff. But really, I would say that 6 weeks ago, a couple months ago, I hadn't heard anything about COVID, and for good reason. The cases were at the lowest they've ever been since pre-pandemic times. And so then suddenly, like in the past month or so, started seeing some articles pop up about COVID numbers starting to rise. So I wanted to do a little segment on it to see, okay, is this like really a big thing, or is it just the fact that summer's ending and people are getting out more because it's been so hot, And I think that does play into it. I know that everywhere is not Texas, but I think the summer's been pretty hard everywhere across the United States, and I don't think people did as much this summer, and that might have played into why the numbers were down.
It's been really rough.
It was rough. So a couple months ago, so early summer, we were down to about 6,000 hospital admissions per week for COVID, which is pretty low in comparison to a year ago when it was 45,000, and way down from the height of the pandemic when it was 160,000.
Pretty drastic numbers.
Oh
there.
yeah, the numbers were insane at one point. There was just a huge issue with hospitalizations for COVID. And so getting down to 6,000 for the whole United States, and this is per week, okay, this is a week time frame, so you're like looking at less than 1,000 per day. That's pretty low. And so we have kind of geared more now looking at the hospitalizations versus total cases, because as you guys may or may not know, the CDC no longer requires states to submit case numbers for COVID, but they are still tracking the hospitalizations. And the other thing that they are looking at these days is wastewater, which when I first heard that, I was like, what in the world are they even talking about? But they can actually look at the wastewater and detect COVID in the wastewater from like sewage.
Oh,
and they're
that
actually
makes sense.
Yeah, it does. It's a pretty cool technology actually, and so they can actually get a somewhat idea of how cases are trending based on the numbers they're getting back from testing of the wastewater. So as I said, a couple months ago, we were at 6,000 hospital admissions per week in the United States. And the last week that they have data, which was actually a couple weeks ago, so end of August, they were up to 18,000 per week. Now, that sounds like a pretty big jump, and it is. It's three times the number. But compared to a year ago when it was 45,000 a week, we're still, less than half, about, what is that, a third, I guess.
And this is all from just like another strain of COVID?
Yeah, and so that's exactly right. So, it's gotten with the COVID variations and mutations that, even I'm like, okay, wait, what variant are we on now? But the variant that's hitting the United States the most right now is Omicron. And now they have like different sub-variants of Omicron. So the two in the United States right now are EG.5, which is called Eris, and BA.286, which is called Parola, which until I looked those up, I had no idea. I had heard that
They really make them hard to memorize.
Yeah, they don't make them easy. It's something to do with like the specific, proteins they look at to identify them as to where they get these names. I guess the biggest thing is that Omicron is still kind of the big one, which, Omicron was better because even though it was a little bit more infectious, people weren't getting as sick.
Yeah.
And we are still seeing that. So there is a slight uptick in the number of COVID deaths that are happening, but it's just a minor difference. And of the hospitalizations of people coming in, the number of people that require like an ICU is only 5% right now.
Yeah.
This is all according to CDC. These are CDC numbers. I'm not making these up. I looked up both CDC and, mostly the CDC numbers of what they're saying is out there right now. So what does all this mean? To me, it just means that there is a slight uptick in the cases, and I nor anyone is not saying that anyone needs to panic. It's very common that as summer ends that communicable diseases do pick up. Flu season starts in September, right?
Yeah.
And so, a lot of people, myself included, have always thought that, COVID's kind of going to settle into this thing where it's almost like the flu every year, where it's going to be seasonal. And it's still too early to say that for sure that's going to happen. But it does kind of look like that might be the case.
Yeah.
So yeah, it'll be interesting to see. And of course, as far as people who have concerns, what to do. I mean, it's all the same stuff that we went over before. If you have concerns, wash your hands, stay away from people that are sick. If you have big concerns, use masks to help protect yourself.
Yeah.
And then of course the vaccines are still out there. I haven't really followed like the different subvariants because every time a new COVID variant comes out, they tinker with the vaccines to try to.
Yeah, I haven't gotten a vaccine since
gotten
you had to like show a card.
Yeah.
To like get in places.
Yeah, I haven't gotten. I think I got. I can't remember if I got one or. I know I got 2 vaccines. I either got 1 or 2 boosters. But for me, and this is me personally, I'm always I'm kind of like in the middle of this debate of because there's a huge debate about the vaccines now. Or, some people think that they cause these problems, which really hadn't panned out in the research. But to each their own. But yeah, for me personally, I mean, the fact that the efficacy, meaning how good the vaccines are, has gone down, and the fact that how virulent the disease, like the virulence of it, has also gone down, meaning people aren't just like the whole thing about people aren't going to the ICU as much.
Right.
And because a lot of people have immunity, not pure immunity, but if you catch COVID, you're less likely to get as sick the next time, just like same thing as vaccine. Yeah, so for me, I haven't really been keeping up with the boosters.
Me either.
Yeah.
You know what's really scared me? That's not
What's that?
COVID. Have you heard of that like amoeba?
Are you talking about the Negligea falaria, like the brain-eating amoeba?
And they said it because we were talking about the lake, and they were talking about how
yeah, that's how people get it sometimes. It gets up in the nose and then into your brain.
Warm lake water.
Yeah. That's so okay. Have we never?
We have never talked about this.
Well, okay, we'll have to talk about it. So I mean, that's a.
Because they posted about it on like.
Well, yeah, the brain. They call it
like a big like news source, like BBC or something,
They call it the brain-eating amoeba because it tends to get in through your nasal passages and it gets up into your brain. And when you get this amoeba, like it's really, really bad. I mean, you can absolutely die from it. But fortunately, it's pretty rare. I mean, like it's so rare that if somebody dies from it, it ends up kind of being a news story.
It was. There was somebody that died recently from it, and that's what it was.
Yeah, I mean, it happens. I mean,
I swear I remember when I was in high school. Have you ever been to Burgers Lake?
No.
It's near Fort Worth.
I haven't been that
It's like this little body.
I've been slumming it on Lake
little,
Louisville.
It's not even a lake. It's literally like a pond. That's
it's
spring.
like a
it's like a
drainage ditch.
spring. It's like a spring-fed pond.
Right.
And
But,
they turned it into like a
just even
It
get
turned
in
into they turned it into like a little like water park, pretty much.
Oh, really?
Like a countrified water park. Anyways, I used to go there all the time when I was a kid. And then somebody died from an amoeba there.
Really?
A long time ago.
All right. By Sarah's request, we have a topic for next week. We'll talk about the brain-eating amoeba.
It's scary. That's why I'm like, oh, maybe I don't want to go to the lake.
Yeah, I mean, it's one of those things where
And I don't want to take Avery because I thought about taking her there before it got too cold. And then they were like, don't. It happens mostly like in like the shallow areas, and
like
that's where
warm,
Avery
stagnant water.
plays is in the sand with the water.
I think realistically your chances are much higher to get struck by lightning, but I'll look into that.
Okay.
I know it's pretty rare. Yeah, I remember when in med school everyone would talk about the brain-eating amoeba, and then and you'd hear a story about it. Oh my God, I learned about that in med school. Not that I would really know what to do if somebody had it. I'd have to like go Google it because I don't remember what the treatment is. It's honestly probably metronidazole, or there are some
Apparently, by the time you have it,
parasitical.
You're done for.
I don't know if that's true or not.
Because the symptoms are so.
Yeah, I'm gonna have to look it up. I've never personally treated a patient that's had it. I've treated some really rare stuff over the years. I've never even, to my knowledge, been in a hospital that's had a patient with it. It's kind of that rare.
That's better.
All right, yeah, I'm gonna look it up for you though, sir. I don't want you to run your life scared. I mean, if you want to jump into a dirty pond, I feel like you should do it.
Oh, gosh.
I don't want you to worry about your brain.
Yeah, no more dirty pond jumping for me.
I'm out.
Done.
All right. But yeah, COVID, sorry, we kind of got sidetracked. Although, honestly, the brain-eating amoeba at this point is more interesting to me than COVID. But yeah, so just so everybody's aware, COVID cases are up. Take precautions as you see fit. Please don't panic. The CDC is keeping an eye on it, and numbers are up a bit. So just take precautions. Very good. All right, moving on to, you guys remember Kelly Osbourne from the Osbourne show? Mm-hmm. She's been out of the limelight for a few years. I didn't really even notice that she wasn't around, which I don't mean that in a bad way. I'm not the best at keeping up with.
Yeah, she did a lot of stuff for E and that
She did.
entertainment news stuff.
Yeah, she was kind of
like
in radio
a
silence
host
for
person.
a few years, and she kind of popped back up in the news this past week because the Osbourne's video podcast is coming back.
Holy crap, that's her?
Yeah, that's her. Right, see, exactly. All right, so
Who is she?
exactly right. So just as Sarah is stupefied by the new appearance of Kelly Osbourne, so was the interwebs. And of course, this spawned a bunch of rumors of her having plastic surgery, which she was denying on some interview that she had. I can't remember if it was People Mag.
Like, I already know that, I would say it was weight, but she's already lost a bunch of weight, and we already know what she looks like.
Boom. So that's it. So she did in 2020 have weight loss surgery. She had a gastric sleeve. And she lost apparently 85 pounds.
Yeah, and like, she looks great, but
She does look great. She looks good. But she was, and for her though, that's a lot, because she's only 5'2". I mean, if you're like 6'4" and you lose 85 pounds, I mean, you're going to notice it. But when you're 5'2" and you lose 85 pounds, like that is a enormous change.
yeah.
And so because of that, and this is all per her in this interview, she said that she lost 85 pounds and she started to feel, good about herself. She started taking care of herself and doing the things to kind of, keep herself looking fresh. And it really did change her appearance. She looks way different. And so people were asking her if she'd had plastic surgery, which she was denying. And she did admit, and it's obvious, I think, in that picture, she's had some injectables done. Maybe she's had, some laser treatments. I mean, her skin looks a little bit different. Her lips look more defined. So yeah, I mean, to me, it's pretty obvious that she's had some non-surgical things done, but I mean, that's not plastic surgery. So her, denial of plastic surgery, I think, is very, very fair.
Yeah.
And so it kind of brought up a question about, is it common for people who have massive weight loss to have surgery? Have we ever talked about that?
Like,
Maybe just touch.
What do you mean, like
So-
surgery? Like,
Well, I mean, so
stomach?
when people do these weight loss surgeries, such as gastric sleeve, they do tend to be very effective. And so people lose significant amounts of weight. And as you guys, I would assume, are aware, when you lose weight, it does have effects to your body. I mean, it's the same principle with pregnancy, and why women who are done with pregnancy are have a higher chance of seeking out plastic surgery. That actually does hold true with people that have had weight loss after weight loss surgery. In fact, there was a study that I was looking at just this week that said after the patients lose their weight from a weight loss procedure, up to 90%, so 9 out of 10 people, consider seeking out plastic surgery.
Yeah, because of like the extra skin.
Yeah, that's exactly right. Yeah,
stuff.
due to changes in their body from skin. And so, when I'd heard that she'd had weight loss and people were talking about plastic surgery, I was like, oh, well, that sounds completely reasonable that she might have done it. And she
Like
said she didn't.
Tummy tucks and stuff.
Yeah, so that's actually, you're exactly right. So the number one surgery that people get after significant weight loss is abdominoplasty or tummy tuck. And that makes sense because, a lot of people do tend to hold extra weight in the abdomen area. And when you lose that massive amount of weight, it is centered mostly in the abdomen for a lot of people, and then everything just kind of collapses and the skin doesn't look great. And sometimes there's enough redundancy of skin that it starts to affect how your clothes fit.
Yeah.
And so, not surprisingly, abdominoplasty is extremely popular. And honestly, I would say of my patients, and I do a ton of tummy tucks. I mean, I average about one a week usually when we're in our busy season, sometimes more than that. And I would say half of them are, probably a little over half are women that are done having kids, but a significant proportion are people who have had weight loss surgeries.
Yeah.
Yeah, we see lots of those people. The other thing that are really popular, especially for women, are breast lift plus or minus implants.
Yeah.
You get women who are used to having larger breasts when they were heavier, and then they lose the weight, and suddenly the breasts are gone, and they're really, if you never had them, then people, I guess, don't know what they're missing. They don't think about it as much.
Yeah.
But when your breasts were larger and you could fill out your clothes and your dresses and your bathing suits, people kind of miss that. The other two things that are somewhat common are arm lifts, where people get the hanging skin. I really do like those surgeries because they're pretty dramatic as far as the results, and they're pretty reliable. I do those pretty commonly, actually. And then lastly are thigh lifts, where people take up loose skin on their thighs. That's a little less common. I think of all of like the body contouring, I probably do the least amount of those. But there are people that get enough loose skin on their inner thighs that it becomes hard to wear shorts or they just are so self-conscious about it
Yeah.
that they'll seek out those we call them body contouring, which body contouring is just a kind of a wastebasket term for anything where you're.
Do you do like that for people's butts? But not like
It's harder.
Not like a Brazilian.
BBL.
Yeah, but it's like.
You can. So they call that a belt lipectomy, where you're basically going 360 degrees around. Like, so you're taking the skin off the front and the back. So I quit doing the belt lipectomy as one surgery, but I'll do it as two. Like, if you do it all at one surgery, it's pretty morbid and it's got a fair amount of complication rate. And I know as the older I've gotten in my practice, I just have less tolerance for risk. I mean, I'm just not afraid to tell people no at this point if they want too much. And so I don't know how many years back it was. I was like, yeah, I'm not going to do those all at once anymore. So, and fortunately, there's not a ton of people that need that extreme amount of lifting, but there are out there. And so, yeah, I occasionally will do tummy tuck on somebody to let them heal and then come back and finish the backside. And it can help out, you know. And what I was going to mention about these surgeries, they're not risky in that people get sick from them, but I will say that they are harder to get that perfect aesthetic result just due to the fact that people have lost all the weight and their tissues are stretched out.
Yeah.
You know, if you get a girl who had a pregnancy where they just didn't get totally kind of wrecked from it, I mean, you can make them look 18 again. I mean, that's totally doable. But when people lose 150 pounds, there are changes that even though you can make it dramatic better and the patients are very happy, it can be hard to make it look perfect.
Yeah, I could see that.
Yeah, but I do like doing them because, you know, honestly, the patients, I think, for the most part, that have lost these massive amounts of weight are very realistic. You know, they'll come out and say most of the time, like, I understand it's not going to be perfect. I just want to get better than this.
Yeah, they're just tired of seeing it probably because they're like, I lost all this weight and I'm
now
stuck with this thing I can't get rid of.
Yeah, and so I love treating those patients because I think across the board they're all very satisfied with the things they do. And once again, I don't do a lot of crazy stuff, and I'm pretty conservative as far as not pushing the envelope on risk. So, you know, we have good outcomes, and yeah, I think in general people really do appreciate the body contouring surgeries. They're very popular right now because there's still a lot of those weight loss procedures that are happening.
Yeah.
So, interesting stuff. All right, I think that might be all the time we have today. But I am very excited that Sarah's got a topic all queued up for me for next week, the brain-eating amoeba. I have to look it up. I don't remember all the details.
Yeah.
I'm actually excited about it too.
I wonder if I can get some of the amoeba like in a jar and bring it in to show you guys.
Is it safe?
I don't know.
No.
I don't even know if you can.
He's like, oops, sorry.
No.
I'm gonna look and see if I can bring some in for sure.
Smell it.
Watch your.
Whoa.
I'm gonna bring nose plugs.
That's right. We're gonna be in hazmat suits.
Oh, God.
All right, brain-eating amoeba is coming up next week. Thank you guys so much for tuning in. Please leave us a like and a subscription and leave us a comment. We want to hear from you. See you next week on Nip Talk.